Welcome dear students. In this video we will discuss the attachments and actions of muscles of the back. First of all, we have to be oriented by the muscles that we will talk about. I have two layers for the muscles of the back. The superficial layer is formed of two muscles. The first one, this muscle which is called trapezius, and the second one, this muscle which is called Latissimus dorsi. The deep layer is deep to trapezius, so I have to hide trapezius muscle to see the deep layer, which is formed of three muscles: levator scapulae upwards, rhomboides minor in the middle, and lastly this is rhomboides major. So we have now to refresh our view to talk about each muscle regarding its origin, insertion, and actions. This is called the trapezius muscle. As you see, it has wide origin from back of the skull, cervical region, and thoracic region. The details of origin is as following. It has three origins, as I told now, or as I said now. From the back of the skull, occipital origin, so it takes origin from the external occipital protuberance and superior nuchal line. You can say it's only occipital origin from the occipital bone of the skull. The second origin is from nuchal ligament. This nuchal ligament is the ligament attaching the 7 cervical vertebrae with each other. And lastly, I have the thoracic origin, which is the spines of all thoracic vertebrae, as you see. So it has three main origins: occipital origin from the occipital bone of the skull, nuchal ligament, which is the cervical origin, and thoracic vertebrae, all spines of all thoracic vertebrae, which is the thoracic spine or the thoracic origin. The muscle will be converged to be inserted into this V-shaped area confirmed or formed by back of the clavicle, medial aspect of the acromion of the scapula, and the upper border of the crest of the spine of the scapula. So you can say the insertion of trapezius is this V-shaped area, back of the clavicle laterally, and medial aspect of acromion process of the scapula, and upper border of the crest of the spine. So origin and insertion show me that the trapezius having three direction of fibers. The upper fibers are descending downwards like this, the lower fibers are ascending upwards like this, and the middle fibers are horizontal. So sure, this will affect the action of the muscle. I have three main actions of this muscle. Regarding to the upper fibers of trapezius, it will pull the scapula like this, so it will form elevation of the shoulder girdle. Elevation of the shoulder girdle, it means elevation of the scapula, and this is very clear in this animation. Only upper fibers will act, so they will elevate the scapula. Okay. Regarding to the lower fibers of the trapezius, if you look to the direction of fiber, this is lower fibers of trapezius, so if they contract, they will pull the scapula downwards. So the second action of trapezius is formed by lower fibers of trapezius, and the action is scapular depression, and this is very clear in this animation. This is a scapular depression by lower fibers of trapezius. If you want to see it again in another view, this is a scapular depression by lower fibers of trapezius. Okay. What about the whole muscle or the middle fibers of the muscle, which are horizontal fibers? The action will be retraction of the scapula. The action will be retraction of the scapula, and this is very clear in this video. The middle fibers only will act, or if the whole muscle acted together, the result will be retraction of the scapula, and this means posterior movement of the scapula. Now let's refresh this view to see the other muscle, which is Latissimus dorsi muscle. As you see, Latissimus dorsi also have very wide origin, thoracic, lumbar, and pelvic origin, and so on. If we wanted to see the details of origin and insertion of Latissimus dorsi, let's see. This is Latissimus dorsi muscle, taking origin from the spines of lower 6 thoracic vertebrae under cover by trapezius. The upper part of the Latissimus dorsi is covered by lower part of trapezius. And the other origin is the thoracolumbar fascia, which is attaching the lumbar vertebrae with each other. The third origin is the back of the iliac crest of the hip bone. And the muscle is going upwards toward the humerus. While it's ascending upwards, it can take some slips of origin from lower ribs and from back of the lower angle of the scapula, in order to be inserted into the floor of the bicipital groove of the humerus, as you see, anteriorly. So the muscle is coming from back and going to be inserted in the anterior aspect of the humerus, in the floor of the bicipital groove, or the medial aspect of the bicipital groove. And we can see here the twist that we saw before in pectoralis major. The lower fibers of Latissimus dorsi will be inserted upwards, while the upper fibers of Latissimus dorsi will be inserted downwards in the bicipital groove. This twist forms with teres major muscle the posterior fold of the axilla. So, if I want to apply the rules of action, I will say that the Latissimus dorsi is inserted into the humerus, so it will move the humerus on the shoulder joint. It will move the humerus on the shoulder joint. Because it's coming from posterior aspect, so it will extend the humerus at the shoulder joint. It will move the humerus posteriorly, so it will make extension in the shoulder joint. And because it's inserted into the front of the humerus, it will make medial rotation. And because it's coming from medial to lateral, it will make adduction of the humerus. So, let's see first of all the extension of the shoulder joint. Look with me in this animation. The muscle is coming from posterior aspect, so it will pull the humerus posteriorly, forming extension of the shoulder joint. Let's see it again. You see, this is extension of the shoulder joint. And because it's coming from medial to lateral, so it will make adduction of the shoulder joint. You can see here, adduction of the shoulder joint. And this movement is helped by pectoralis major. So both pectoralis major and Latissimus dorsi form adduction of the shoulder joint because they are coming from medial to lateral. And the last action is the medial rotation, which is formed also by pectoralis major. Why both pectoralis major and Latissimus dorsi form medial rotation of the humerus at the shoulder joint? Because both muscles are inserted into the anterior aspect of the humerus. Okay? Very nice. Now we will return again to our view to hide Latissimus dorsi and to hide Trapezius also. So I have the 3 deep muscles, namely Levator scapulae, rhomboides minor, and rhomboides major. Let's start with Levator scapulae. As you see, it's coming from the upper 4 cervical vertebrae. In details, this is the origin and the insertion of Levator scapulae, like this. Transverse processes of upper 4 cervical vertebrae going to be inserted into the back of the medial border of the scapula above the level of the spine. Above the level of the spine. So, the action of this muscle, sure, it will be scapular elevation. It is the same like upper fibers of trapezius, and the action is very clear here. You see, this is levator scapulae, and this is upper fibers of trapezius. The action is elevation of the scapula. So it acts also on the shoulder girdle. Very nice. What about the other two muscles, rhomboides minor and rhomboides major? If you see rhomboides minor, it's a very small muscle taking origin from the spine of last cervical vertebrae and the first thoracic vertebrae, C7 and T1, and going to be inserted into the back of the medial border of the scapula at the level of the spine, of the scapula. What about the other muscle, which is rhomboides major? It will take origin from the following 4 thoracic vertebrae, namely 2nd, 3rd, 4th, and 5th thoracic vertebral spines, and will be inserted into the medial border of the scapula below the level of the spine. Regarding to the action of both rhomboides minor and rhomboides major, it will be the same as middle fibers of trapezius, which is retraction of the scapula. We can see it in this view. Retraction. Middle fibers of trapezius with rhomboides minor and rhomboides major will form retraction or posterior movement of the scapula. Okay, what about levator scapulae with rhomboides minor and rhomboides major, the 3 muscles, if they act together? So I have levator scapulae, elevator for the scapula. Rhomboides minor and rhomboides major are retractor of the scapula. Let's discuss if the 3 muscles acted together, like this video. You see, levator scapulae, rhomboides minor and rhomboides major will pull the medial border of the scapula like this, upwards like this. So this will form downwards rotation of the scapula and downward tilting of the glenoid cavity. So the action of the 3 muscles, levator, rhomboides minor, and rhomboides major, with each other, they will pull the medial border of the scapula like this, causing depression of the scapula, or downward rotation of the scapula, or downward tilting of the glenoid cavity, and this is done by the help of pectoralis minor. And now we finished the back muscles, and goodbye to the other videos.